Good day and welcome back to this part of our July edition of Mood Disorders. I'm going to discuss the treatment of anxiety disorders today, and I'm Jacques Vermeulen from McLachlan Vermeulen and Associates. The best intervention with anxiety disorders is always a combination. So that would mean medication, which we would get from either your general practitioner, your GP or psychiatrist, and then psychotherapy. The combination of these two modalities seem to be the best in the treatment of anxiety, and it would have the most long-lasting effect will be if we work together with both of them. Medication, often 6 months to a year, but that would depend on your condition, obviously, as well as other comorbid features, and that would also be considered by the psychiatrist or the treating physician who decide the duration of the medication. Psychotherapy will then focus on behavioral patterns, thought patterns, the language I use, and to realign or readdress this so that I can cope better with my anxiety and my misinterpretations in future. Two popular therapeutic interventions used are CBT, or cognitive behavioral therapy, and cognitive behavioral exposure. CBT, if I could quote Shakespeare, who said, "There's nothing good or bad, but thinking makes it so." And this is the crux, in a way, of CBT. CBT intervention acts in two parts. We look at the cognitions, or the thoughts that reinforce our anxieties and our panics, and we also look at addressing the behaviors we have towards a situation or towards the anxieties. In other words, we're looking at readdressing or reassigning my thought patterns. Is this really bad? Am I really going to die? Is this really the end of me? And I also look at addressing or changing my behavioral patterns. No, my heart is beating fast. Yes, it's true, but I'm not having a heart attack, for example. So both of these start to work together. My cognitions, what I think, will influence my behavior, and that will influence how I feel. And by changing or connecting those two parts again, normalizing it, my reaction towards anxiety and panic obviously will be better. The second part, the cognitive behavioral exposure, has to do with gradually exposing a patient to the anxiety-provoking trigger. Now, there are different names for this as well and different techniques to do it, but if you, for example, get quite anxious because of being alone, for example, or going alone somewhere, gradually you will be exposed to, for example, going to a mall or a social situation where you will be increasingly on your own. Or maybe a spider, you'll watch movies about a spider. It's gradually you are exposed to the object of fear. And post-traumatic disorders, for example, or sufferers from that, you would, for example, use the exposure technique where you gradually get the story of what happened, the traumatic event, and then gradually realigning it and normalizing it for the patient to take the emotion out of it. Depending on the, if I could use the word, level of your anxiety disorder or the intensity of your panic attack, there are also several self-treatments that we could use to avoid or reduce our anxious behavior or patterns of thinking and feeling. For example, bibliotherapy, in other words, knowledge is power. To start reading up and getting some information, reputable information about anxiety, about panic attacks, about what I can do. Affirmations, another wonderful method to use. Daily positive words and phrases that we give ourselves. Meditation, wonderful. Yoga, fantastic. Guided imagery, workbooks, breathing exercises, going for a massage, self-care, just loving yourself, looking after yourself for a change, because we often neglect ourselves as well. Healthy friendships, pets, fantastic source of anxiety and panic-reducing source, pets. Rituals that you put in place, before you leave home, before you get home, and things you do. I will pray first, or I will first do this before I do that. Things that you use to ground yourself, to normalize a situation. And then spirituality of any form is always fantastic to use to reduce or prevent that anxiety runs away with me. Anxiety can be prevented in much the same way as depression, and I would like to ask you to look at Gerda's section on the treatment of depression, as she mentions a lot of the same methods on how to reduce or prevent or treat, in a way, depression. A lot of them are the same, like the eating, the exercising, the sleeping, and all those types of things. But watch her section where she discussed that in a little bit more detail. Thank you again for watching. I hope this would help you in alleviating some anxiety or panic, especially in winter when things tend to get out of hand and we tend to exaggerate what happens to us. Until spring, of course, then things look always better. And hoping to be back with you in August with our next section. This is then Jacques Vermeulen from McLachlan, Vermeulen and Associates. Please follow us on Facebook, on our website www.volpsychologists.co.za, or contact us on 016 9711 339. Thanks and have a good day.